Welcome, folks, to the microbiology bugs talking. Today, we will have this microbiology class. Like I tuned into the YouTube, we will have the microbugs. We will have, or quickly we'll go. We'll showing short of time. Few bugs we'll have in this first study. That's Malassezia furfur, Tinea versicolor, and muco we will deal first. Vesicolor, Tinea versicolor, Malassezia furfur is superficial brownish, dry, scaly patch, light-skinned patient and lighter pattern on dark-skinned person. And what you do is microscopically take the scaly skin and on KOH you do it on KOH and you get oval or bottle shaped cells you will get. And you can explore uh, monopolar budding with cell wall and small hyphae. These are the which you have top study on the tinea versicolor. If the problem man have micro, if you want to give the problem man the microbiology thought, then you can give this. This is the best you have. So don't stop today. You want to give the problem man the microbiology books on versicolor. Quickly, we'll go now to Mucorrhizopus family, mucormycosis. What we have is they are very well related to vascular thrombosis, tissue infarction, necrosis, lymphoma related, leukemia, diabetic ketoacidosis, neutropenia, renal failure. That's all we have in mucorrhizopus. Then we will be studying uh, RSV, that is respiratory syncytial virus. Respiratory syncytial virus. Respiratory syncytial virus. The problem man. Let's give the problem man. What's the hurry problem man? You will get the microbiology notes. Don't have the problem. You will have these microbiology notes. Gets back. This is respiratory syncytial virus. CRU. Keywords are CRU, bronchitis, bronchiolitis, interstitial pneumonia, less than 1 year old, hospitalized. Most susceptible people are hospitalized, and the most susceptible group are less than 1 year. Period. It is mentioned that less than 1 year is the most susceptible group provided. So that's all we have on respiratory syncytial virus. Then we have Hanta virus. Hanta virus, they are studying rodent host, deer mouse, southwest United States of America, simply sin nombre virus from that place is another name for the Hanta virus. And it is usually from the breathing in excrement and lung site. They are multiplying in the lung site and breathing of the excrement. From the excrement, the IgM ELISA assay is the point you will give for the problem man from the microbiology notes. All we have. And please don't give up to your studying, but tune to my channel for valuable notes of mine. Also, we have cholera. What you talk about cholera, which is very prevalent in India, Calcutta, and so cholera we are having Vibrio parahemolyticus giving green on thiosulfate citrate bile, and Vibrio cholera itself only it gives yellow on thiosulfate citrate bile. And Vibrio cholera is the only bug which gives a positive string test, and you can made with sodium deoxycholate and 5% on a glass slide and 60% with the loop lifted. You give a typical string of pearl appearance. That's all we have on cholera. and Vibrio parahemolyticus. And you have rabies, fluorescent antibody, PCR testing, replicates in site of the wound, and CNS spreads to CNS, and you have post-exposure anti uh, rabies immunoglobulin, anti-rabies immunoglobulin. That's all we have on rabies virus. Then you have tuberculosis. We have first morning specimen expectoration and nebulization. Then you have AIDS. With AIDS, TB is Mycobacterium avium complex, highly resistant to antibiotics. Highly resistant to antibiotics like streptomycin, rifampicin, ethambutol, ethinoamide, ethambutol, and cyclosporin, kanamycin are little success. That's all we have the talk on tuberculosis. Then we have gram-positive spore-forming Bacillus Clostridium perfringens. You have double-zone hemolytic blood agar, eta complete hemolysis, inner eta complete hemolysis, and outer incomplete hemolysis, lecithinase activity. Negative, where is you can find no negative double zone of hemolysis in bacteroids as well as the difficile family. And one more bacteria we are dealing today is Neisseria species. Neisseria species are all oxidase positive, and Neisseria gonorrhea is a superoxide test, that is 30% of hydrogen peroxide with bubbling, and all the that is especially for Neisseria gonorrhea, as well as, and the 3% peroxide is also positive with all the Neisseria species. If any doubts, any sharing, you can share and subscribe. If you have any doubts, you can talk to the next lecture. Thank you, students, for tuning.